It's so great to have you with us this lovely day as we get into the panel of discussion. We are very excited that you are able to join us. Quickly, my name is Dr. Olaide Goshiji, a senior lecturer at the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. I am the subject coordinator for the subject HLTH 7002, Building Organizational Capacity in Healthcare. I would like to acknowledge the traditional owners of the land in which we are all sitting or standing at this moment, and we thank all the elders, past and present. It's really great to have this powerful panel joining us today to share their extensive wealth of experience with us. And just a brief introduction, and I would ask them to introduce themselves as much as they would like to share with us. Looking at my screen, the first person that on my screen is Melissa Montero, who is the Chief Executive Officer of Community Migrant Resource Center, Parramatta, Western Sydney, Australia. Follow quickly is Ashani Senanayake. She's a nurse unit manager at Blacktown Hospital in Sydney. And immediately after her is Jan Leach, Executive Officer and Manager for Blacktown Women and Girls Health Center. They are here to share their wealth of experience. And quickly, I will ask them to introduce themselves as much as they would like to share with us. So, starting with you, Melissa. Thank you.
Thank you, Dr. Olaide. Very good morning and hello to everyone, and hello to also my fellow panelists. I'm really delighted to be here today, and let me start by acknowledging the traditional owners of the land, their elders past and present, Community Migrant Resource Center. We're a medium-sized, not-for-profit NGO based in Parramatta, and we have a large footprint in Western Sydney. Now, my title and core of my work is in development for the last 21 years to be precise. But I have about 3 decades of experience in the not-for-profit world, in the not-for-profit sector. I am also the chair of the Settlement Council of Australia, which is an umbrella overarching body of all the settlement-funded agencies across the country. So not just in New South Wales, but also in Victoria, in Tasmania, WA, right up to the Northern Territory. We, as service agencies, provide settlement services to newly arrived migrants and refugees, and that's the one thing that holds us, is the commonality in the work that we do. I have been on a number of the other areas that I want to share with you today in terms of organizational capacity. Also, is I'm board director on the Anti-Discrimination New South Wales, ABNSW, which is a government body, and I'm on the statutory board, and I've been there for the last 4 years now, and this is the 5th year running. So I bring what I call a wealth of knowledge and experience in settlement and in the community sector, and more in organizational capacity, as I run a medium-sized organization with 150 staff and contractors, and I look forward to sharing more with you today. Thank you, Olaide.
Thank you so much, Melissa. What a wealth of experience. We're so privileged to have you in the panel. Over to you, Shani, please. Yeah.
Hi, so I'm Harshini Senanayake. Everybody call me as Shani. So I've been working as a registered nurse for 15 years now. I started as a new graduate in Blacktown Hospital in 2007, and I worked for cardiology for almost 10 years before moving my leg into a district position as a safety culture coordinator. And then I came back to Blacktown as a nursing unit manager for general medical ward. From then, I did a bit of secondments as patient flow unit manager and also after hours nurse unit manager, where I get more understanding of management of staff and all the other services during after hours services, after hours phase. And now I'm actually working as the acting aged care nurse manager, who's in charge of all the aged care services across Blacktown Hospital. And during the COVID time, I've actually took the lead as the operations lead for COVID management as well.
Thank you so much, Shani. And just like you said, we popularly call you Shani.
Yes, that's right.
Okay, thank you very much. We are happy and delighted to have you on this panel as well. Now over to Jan, please. A bit more about yourself. Yeah.
Good morning, Dr. Olaide. Good to see you. Thank you so much for inviting me onto the panel today, and a warm welcome to my other panelists that are joining us today. My name is Jan Leach, and I'm the Executive Officer at Blacktown Women's and Girls Health Centre. And our centre is a community-based non-for-profit women's health centre which provides accessible health and wellbeing services for women and girls in the Blacktown local government area, regardless of their income. Our peak body is Women's Health New South Wales, and we're a part of 21 community-based women's health centres in New South Wales, which share a similar mission and ethos. Our community in Blacktown our service provides health and wellbeing services to women and girls in Blacktown LGA, a huge and diverse area with high levels of cultural and linguistic diversity, and many areas of Blacktown local government area experience high levels of socioeconomic disadvantage and poor health outcomes and high levels of unmet need. And it comes to that are needed for service provision across the LGA. We also auspice for Legal Aid New South Wales, the North West Sydney Women's Domestic Violence Court Advocacy Service. They're at extraordinarily high levels, much higher than anywhere in the state, of domestic violence across our LGA. And the COVID pandemic that we've been experiencing has seen an absolute peak in domestic violence across the LGA, and we work proactively on the leadership group of the local domestic violence partners organisation, looking at ways as a whole community that we can combat domestic violence, which is really important to us. But we are committed to providing professional, affordable and holistic gender-informed service, promoting health, wellbeing and empowerment for women, and delivering a caring, non-judgmental, this in a caring, judgmental and respectful and safe environment. And I'm very happy to be here today and looking forward to talking about how we operate further. I've spent the last 30 years of my career working in non-for-profit charities, working for the last 20 years as a manager of services, a wide range of those being multicultural neighbourhood centres and big corporate, not-for-profit organisations. My current staff load is 47 staff and volunteers, and we work with a diverse range of clients and community, and my staff come from different socio-economic as well as cultural, and also work with Nova Employment, which provides us with staff with differing abilities that women can come back into the workforce. So thank you for having me today.
Wow, thank you so much, Jan.
Thank you.
We've got a very, very powerful panel today. Thank you for those words of experience you have shared with us. Together, we have about 6 questions to respond to. And by the time we are about to round up, I will ask if you have any other addition to make to what you might have said. So let's get started with the first question. And that first question, I will throw it to Melissa. Can you please tell us the vision, mission, and structure of the organization that you're Chief Executive Officer to? Community Migrant Resource Center, Melissa. What are the vision, mission, and structure of the organization? Thank you.
Dear Dr. Olaide, I truly believe in the vision and mission, in my own vision and mission, and that of the organization. It's very, very essential, and especially for university students and people who are going through this course, it's very, very important that this forms the basis and foundation.
And by the time we are about to round up, I will ask if you have any other addition to make to what you might have said. So let's get started with the first question. And that first question, I will throw it to Melissa. Can you please tell us the vision, mission and structure of the organization that you're Chief Executive Officer to. Community Migrant Resource Center, Melissa. What are the vision, mission, and structure of the organization? Thank you.
Thank you, Dr. Olaide. I truly believe in the vision and mission in my own vision and mission and that of the organization. It's very, very essential, and especially for university students and people who are going through this course, it's very, very important that this forms the basis and the foundation for the work that we do. If there's clarity of vision, then your steps and the work that you will deliver will always and go back to your vision. And I always say that we should never lose sight of our vision, because the vision helps you to be
With us. Please,
Yes.
we get back to Melissa.
Okay.
Over to you, Jan. Thank you.
Our service principles are that we're a community-based non-profit charity run by women for women. So we're also a feminist organisation, and our ideals and visions are that we focus on the prevention and early intervention, and we work in partnership with other agencies. We are accessible to all women and girls and children in our community, and we strive to maintain ethical standards for all our activities, and we are committed to best practice. Our work environment reflects our values. Our values, we recognise that women's health encompasses the physical, spiritual, environmental, emotional and social well-being of women and girls and children. Blacktown Women's and Girls Health Centre offers a holistic approach to understanding, managing and supporting women, girls and the broader community in the Blacktown local government area to make informed decisions about their own health and well-being. This approach is based on a feminist philosophy with an emphasis on respect and empowerment for all women. Our values are dignity. We treat all people in a way that is respectful of their diversity and as valued individuals. Compassion. In our interactions with people, we strive to be kind and empathetic. And optimism. The unwavering belief in the positive potential inherent in people and society. Our mission is that we are committed to providing a professional, affordable health, holistic, gender-informed service promoting health, wellbeing and empowerment for women, delivered in a caring and a non-judgmental, respectful and safe environment. We achieve this by providing a holistic women's health service to the community, educating women and children so they can make informed choices about health and wellbeing, empowering women and children to make informed choices throughout their lives, and providing safe place for women and children, advocating for and supporting women from a feminist perspective. These are our missions, our values, our principles, and we do this in our diverse community. How do we do this? Well, we run a doctor and nurse clinic at our centre, and that's a female doctor and nurse run clinic at our centre on Wednesdays with Family Planning New South Wales. We have relationships with legal in our centre, which is Women's Legal New South Wales and the Western Sydney Community Legal Forum, come on site to assist women who have legal issues that they need assistance with, including domestic violence and sexual abuse. We work with our counselling team in domestic violence and general case management on a daily basis. And we also have a naturopath in the centre and a massage therapist. We have MOUs in place with other organisations such as Relationships Australia, which provide us with group work with women who are looking at choice and change in their lives. We have a program officer where we work collaboratively with our community. We go to community information stalls and provide out information, and we also have health and wellbeing talks in our centre. During the whole of COVID, these last nearly 2.5 years now, we've provided free food to over 40 families every Friday through our collaboration with companies such as OzHarvest and Food Bank that provide food to us to help and assist disadvantaged families and community. We join in with project development with other organisations, and of course we do that with our sister centre, the North West Sydney Women's Domestic Violence Court Advocacy Service, who work with us and provide referral pathways for their clients at high risk from domestic violence. We also have a police prosecutors clinic in our centre at Blacktown once a week on a Thursday, which assists women needing to present to court on apprehended violence order matters regarding their having been victims of domestic violence. We have a Women's and Girls Domestic Violence Emergency Fund in place where we get funding and donations from other organisations and individuals across our LGA, and with that we can provide safe overnight accommodation to a family experiencing or fleeing from abuse. We can also provide that to a homeless woman seeking assistance, and we provide safe transport from our centre to that accommodation, and we provide food vouchers which allow the family to get food on the way, including we give them emergency backpacks for the women and the children so that we know they're safe, and we collect them the next morning and bring them back to our centre. So we're always looking at ways of creating opportunities to work more broadly and engage with women in the community. And we've got a program running with the Australian Drug Foundation, and we're looking at fetal alcohol syndrome. At the moment, we're providing art therapy groups twice a week to women in the age groups from 17 to 24 to attend those groups, and in that is also a discussion is held on fetal alcohol syndrome and the negative effects that has on women who have carrying children, or about to create a life and carry that life. So we work closely with Blacktown Hospital and all the police and all the other agencies locally to achieve the outcomes. We're really seeing a lot more clients than we are funded for, so funding is always a priority, but I think I'll talk about that later in another section we'll be discussing. But the door is always open. Every woman who comes to us is helped if she needs help. We don't turn any woman away, or any girl away, or any child away that comes to us. And if they can't afford to pay a fee for one of the services we provide, if they haven't got the money, we don't make them pay. We also work in collaboration with Western Sydney University. We provide student placements for social work students at Blacktown Women's and Girls Health Centre and for art therapy students at Blacktown Women's and Girls Health Centre. We also provide placements for counselling students, and those students who come to us are from the Australian College of Applied Psychology in Sydney, and they come on place. We take up to 4 students from ACAP at a time. We have an intake officer who supervises those students, and they are an absolute total benefit to our organisation to have students on placement to assist us with the ever-increasing workload that we have to meet the needs of women and children and girls in our community.
Thank you so much. Thank you very, very much, Jan. And clearly, you have shared the vision and the mission of Blacktown Women and Girls Health Centre with us, and how that has over the years informed the services that you provide. I would now go back to Melissa, who was trying to tell us how important vision is in driving what they do and how she leads Community Migrant Resource Centre. Over to you, Melissa. Thank you.
Thank you, Dr. Olaide. I think my internet had dropped off for some time.
Yes.
It is beautiful to see that, we're working in the same space. So it is a bias for action, leadership, partnerships and collaboration, and financial sustainability. Now, I'd just like to put this into context, if I may, before I go into the next part and talk about my organizational structure. And I think for students, it's important for us to introduce the underlying basis for the work that we do as a migrant resource center, because migration, we believe, is a life event. Pre and post migratory experiences have been the focus of migrant literature in the past very many decades now, especially here in Australia. The duration and the type of traumatic experiences contribute to significant distress, loneliness, and other issues and other settlement issues where people come to our country from other neighboring countries across the world. Now, a steady rise in Australia we have seen in migration and in the migration programs, which really prompt service providers like ours and practitioners like myself to enhance our competencies in dealing with multicultural clients. In order to support migrants, including refugees and humanitarian entrants, it is important to identify and assess their needs, understand their losses, to be aware of cultural differences, and also to be informed of their preferred support systems and barriers to help seeking. With this in mind and this backdrop, the CMRC provide settlement services, which is one of our largest funded programs, and that forms the core of our work and the core of our business. We're based in Parramatta, and we have over 26 staff that provide bilingual support and settlement information and referral to newly arrived migrants and refugees, humanitarian entrants. Now, we have a kind of a balance, and we maintain a balance between our refugee and our migrant intake and migrant numbers. And in the last decade, especially in the last 10 to 12 years, we have seen that the cohorts change. 15 years ago, it used to be African communities. 10 years ago, it changed to the Middle Eastern, to Afghani, because of what happened in Afghanistan, the Taliban coming in. Then about 5-6 years ago, you had the Syrian refugees. Last year, about 8-9 months ago, we all saw, the Afghan refugees recoming now, and people from the Middle Eastern countries as well. So to put it into the context of the global scenario, every one of our services are responding to the global political and the civil unrest that is happening across the globe. In order to respond to that, we've got a large pool of funded, full-time funded and part-time funded workers. And that's the structure of our organization, where we've got the board, you've got Melissa as the CEO, and then I've got this fabulous management team. We have about 6 management teams, and each one of them are headed by a full-time manager. And the SETS, which is the Settlement, Engagement and Transitional Support Program, which is a program that I just spoke to you about, is by far one of the largest funded programs. It may not be the largest team, but it is one of the largest funded programs. We also have a very large footprint in Western Sydney that is providing support and early intervention services to mums, to parents with children 0 to 4 and 0 to 8. Can you hear me, Adi? Because my
yes, I can hear you. Yeah.
So I'll continue talking about the early intervention program. The early intervention program is more Western Sydney based, focusing on families with children 0 to 8 and 0 to 2. It has a perinatal component, of which we have partnered very often with you as with your university, with Western Sydney University, over the last 8 to 10 years. We provide support to families with these children, as in running play groups, mothers groups, social support groups, and we do that in a very big way in Western Sydney. We have about 11 social support and mothers groups, play groups in Western Sydney regions. Each one of these groups are well attended, and many of these are groups that are mixed groups with multicultural groups, communities from various backgrounds that are mixed. Now, playgroups provide an opportunity for moms to break the social isolation. You could have a newly arrived mom who would have just arrived maybe a week ago and who would join the playgroup. It's a very soft entry, and we find that it's a great way to connect with our migrant communities, also our refugee communities, because they're so new to Australia and don't understand the landscape. The third largest program that we provide is a program that is also funded by the Department of Communities and Justice, which is DCJ. And this program provides child protection services to our local CSCs, which is the Community Service Centers of DCJ. So we provide support to DCJ funded services across the whole state. It is a statewide program, and it's been running and operating for the last 15 to 18 years. It is a very solid program that started off small and then just grew into a very much more solid program that covers the whole of the state now. So it's called the Multicultural Support Workers Program. In addition, LID, we provide youth services, and we've got a very large federal funded program called the Refugee Youth Transition Support Program, which is YTSP. And this again involves the whole of Western Sydney, including local government areas of Blacktown and Auburn and Parramatta. And we have a partnership and collaboration, which again goes back to our core values, which include the collaboration with other services in the area, including the SydWest in Blacktown, you might have heard, as well as ATSI in Urban Diversity Services in Auburn. So together, we 3 agencies in Western Sydney form a really strong partnership in addressing the challenges of young people in Western Sydney, especially refugee young people. We're trying to engage with the disenfranchised young people, helping them to engage in education pathways leading to employment. We also have LID business services, and we provide business services. So our organizational structure has a business services manager and a large business services team, once again, which is a statewide program, and this is funded by the Treasury, New South Wales State Treasury. And our business support advisors provide advice to multicultural businesses, including the Chinese, the Korean, the Arabic, Vietnamese, and the Persian communities, Afghani communities, in their language. It is a bilingual support for these businesses. Now, again, the structure involves a third tier where you've got advisors, as in contractors, who used to be staff, but now for various reasons they are contractors and delivering these services. The organization also has a lot of volunteers, and we've got at any point in time over 20-30 volunteers assisting each one of our groups. So as you can see, we've got a very kind of a vertical structure. You've got the board, you've got the CEO, you've got a management team of 6. Till the last year, I had 9 managers, but before, because of COVID, it's not that we lost positions, but we positioned ourselves better during the pandemic, and we had to downsize the organization and have a more leaner team. And so I've got now 6 managers, actually 7 very recently. We've got business support, a manager funded as well. So we've got about 7 managers. And then you've got the 7 staff and contractors in each one of these programs. And that makes us a medium-sized organization with about 150 staff and contractors and volunteers. Volunteers are not included in this number though, because that's over and above this number. Oladi, I'll stop here and I'll let the others talk, and I'll come back to you.
So much. Thank you to you and Jan for your generosity in sharing, your vision, mission, core values of your organization, and you've gone into great depth in telling us how all those vision and mission actually drive, how your core values, inform your day-to-day approach to what you do. Thank you so much. Shani, it's over to you now. One thing we know is that healthcare and community organizations are faced with the challenges of rapidly changing internal and external environments. Can you please share with us the nature of the rapidly changing internal and external environment that Blacktown Hospital, where you are a nurse unit manager, has had to deal with? Thank you.
Thank you, Dr. Livy. Yes, so when we think about internal changes, we recently had a leadership structure change. So it went from a divisional-based leadership structure back to a stream-based structure, which is to align the medical and nursing, but the leadership positions. It feels like that every 5 to 6 years that these things happen, but I believe that it is for a reason that we always need to change and align our priorities according to what people needs and what the patient safety ensure, things like that. And so now kind of sits under a stream of medicine. So it covers pretty much all the specialties that comes under stream of medicine, which is respiratory, cardiology, general medical, geriatrics, and all of that. When I think about the external environment that influenced the organization, I mean, we had a rapid growth, population growth in Western Sydney. So like the new suburbs developed, and we are constantly trying to expand our services to meet the demands of the people of Western Sydney, and also and then add to the more complications. It's the more growing geriatric populations as well. Obviously, with the advancement of medicine and other health services, people are living longer, which is a good thing. But that adds to complications in the hospitals because the patient that presents is more complicated and have more complex medical issues that need more collaborative approach from all services that we have. And also, as Melissa mentioned, we have a diverse, culturally and linguistically diverse population in Western Sydney. So we need to cater for those patients, families that, with interpreter services and other services that can help these people, because the health literacy is a bit of a challenging area that we're having in Western Sydney. So those are collectively adding to complexities in managing hospitals at the moment. There are strategies in place, we are constantly working on changing our environments and expanding our services, putting services in place to grow with the complexities that we are facing. And that on top of that, then it adds the staff training needs. So when the patients are more complicated and have complex issues, then the staff that treating them or looking after them need more advanced skills as well. So that then we looking at more staff training, instead of having workforce that is specialty based, having more skilled workforce that is we can utilize everywhere. Especially recently, the COVID has added to the complexities as well. So staff had to be more flexible and learn new skills. A good example is when we actually suspend our non-urgent elective surgeries to meet the needs of the growing COVID needs. Those theatre staff had to adapt to work in normal COVID wards environments, which was challenging. So we were providing them constant support with nurse educators and clinical nurse educators and all other services that we had available at the time.
Ashani, what we are getting from what you have said is that with the rapidly changing environment that we are in is the increase in complexity. Thank you for that. And and the acute sector that you represent is not immune to that at all. Now let's hear from Melissa. In the course of your talking about the vision mission in the first instance, you spoke a little bit about the rapidly changing external environment that you constantly needed to respond to. I'll still throw the same question to you, Melissa. That community organizations and healthcare organizations are faced with challenges of rapidly changing internal and external environment. Please share with us those rapidly changing internal to CMRC and external environment that you have had to deal with. Thank you, Melissa.
Thank you, Dr. Olaide. It is very important for us to understand the changes and the broad factors, such as the political, the economic, the social, the technological trends which influence our business, whether it is a community organization or whether it is a profit organization or a not-for-profit. Either way, it doesn't make a difference, but it's very important. I always believe that it's important to stay ahead of the game, and because it is important to also treat your organization as a business, and it's important to know and understand where you sit in the marketplace. It is important for you to understand where you are situated in the industry at this point in time. At the CMRC, we do that all the time, and internally and externally, there are a number of factors that are influencing our work every day, and you've got to look ahead of time when you're planning And as you know, we do a lot of planning once a year. We take a retreat and go a few days off as a board. And that's very important as an organization to remember to take time to actually sit down and to know where you are and where you want to be and discuss that. Because that's the place where you can actually talk about the challenges that face your organization internally and externally. So today I'm just going to talk about I'm going to start with the external challenges or the external, the global situation and the global scenario. Very important. I'll start with the global. Firstly, things that have challenged our organization from a global point of view is that we've all seen what COVID has done at a global level, what destruction COVID has created globally, the destruction and loss of life on a scale that we've never ever seen before. We also have seen Omicron after that. Just when you were thinking COVID is gone, then you have all these number of variants, including the Omicron. So I'd say if you look at the environmental factors globally, you have the health crisis around the whole globe. New South Wales is still on the, I wouldn't say on the rise, but it goes up and down, and now is probably, I can say, on the decline. Though, if you look and compare, there are some places where it's just coming up and then it dies off. But it's not so much in the news as much as it was maybe a few months ago. Globally, you can see the world is at war. Right now, we are faced with the Ukrainian invasion from Russia. And I'm not going to spend any more time on that, but you know how deep and sensitive that whole issue is. Nationally, you can see that we've had a huge intake. Very recently, the government have announced an additional intake of 16,500 Afghanis and people that are going to come from other countries. Some time ago, there were about 5,000 Afghan nationals that were taken after the crisis that happened in Afghanistan. Now, Australia will continue to get more and more diverse. And diversity is seen, first of all, we've seen that in Western Sydney, you can see Western Sydney is so very diverse. And the number of our Afghan arrivals have increased and will continue to increase. Those that were unable to enter in 22 will start arriving later in the year when the situation stabilizes in Afghanistan even. And it will continue to stabilize. The government have already announced now that about 800 Ukrainians have arrived in Australia. And that is going to continue as well. That is at a national level. Now, the federal government, as you know, is going to call for elections anytime, and so we need to keep on the lookout for that. But that is something that will influence and impact the work that we do. You may ask and say, why? Because remember, as Black Down Women, Girls and Health is also funded, we're a fully funded organization. Of course, we have a very small fee-for-service component, but it's important for us to know which government is in power at the time, whether it is a Liberal government or whether it is a Labour government. And it's important from a point of view of which government support which work at what point in time. Now, as a migrant resource center, we are open to working closely with both sides. We've always maintained we've been that apolitical. But being apolitical doesn't mean to say that we're not constantly on the lookout to know which government is going to be in power. And, I'm not sure what will happen in the elections, but I'm just saying that when you do an environmental scan and look at organizational capacity and organizational changes, it's very important to do an environmental scan that will cover your national trends or the global situation, etc. The third part of it is that the federal government have approved visas and will continue to approve more and more visas, and more people from various countries will continue to come to the country, not just on humanitarian visas like Ukraine and what I spoke about Afghanistan, but the settlement, the migration intake changes. Every year, Australia already takes in 13,750 migrants and refugees. And, those are the places that have been allocated by the government. That's why it's important to know which government, because not all governments support the increase in the intake. And it's very important for us to have governments that increase the intake because of the work that we do, especially from a community migrant resource center. So we welcomed the 16,500 places recently. The other national factor and the national trend that should be considered is the economy and the budget. And you can see that the budget has just been announced, in fact, just in the last week. And you can see that the government have focused quite a lot on the migrant, and quite a lot of allocations in the budget were made, especially for employment and employment outcomes for these communities. So that's very important when you do an environmental scan and when you're scanning, and these are the challenges, because that again affects our work directly. If there is a budget allocation, like for example, we would like to have an increase in our domestic and family violence workers. We've got 3. We would, for example, I'm saying, we would like to increase it, or I'd like to increase my work with other communities that I'm not funded for. So that would mean that I understand the government release, the budget release, and what money is allocated for which community at what time. So economy and the budget is very important. The elections are very important. The social infrastructure, limited housing. I won't go into details there, but limited housing, accessibility, income support, social mobility, and meaningful employment are one of the biggest challenges, or all of the biggest challenges that we face. As not-for-profits or IB, I think the shift to outcome-based funding is one of the other challenges. The government expects now that you have tangible outcomes, not as in previous years where you had grants, but now it is outcome-based. You achieve a certain outcome and then you get your funding. If you don't achieve your outcome, you're not going to be getting your funding. If you don't get X amount of people, 100 people into employment, tier 1, tier 2, tier 3, depends on which background they are, you're not going to get your funding if you don't get that employment outcome. Digitization, if you know, after the pandemic, this is something that we all literally woke up to, and we were snapped into that response where we had to make sure we were digital ready. And we found that within our migrant and refugee groups already, that digital literacy was very, very poor. And there was increasing digitization of our key services and the pressure, and I feel there was pressure on us as settlement services to digitize ourselves as an organization, but also that we help our communities and local communities to get prepared and to get ready. The larger, bigger picture challenges that I can talk about, really I'll just touch base because I'm running short of time, would be workforce shortages in Australia. These issues are very, very complex. During the pandemic, we've seen the impact of no international students or no visitors to Australia, which has impacted our organization considerably, and also the impact of seen on our other consortium members and other lead agencies in the field and space of settlement. Effects we have seen nationally on impact of tourism and economies and businesses that depend on these. I think the business sector has done it and hit it hardest. Small businesses have been impacted the worst. We have a funded program dealing with multicultural diverse businesses, including like I've spoken to you about the Chinese and the Korean, the Afghani, the Arabic, the Vietnamese communities. These businesses have all, along with other businesses in New South Wales, have really suffered huge and a very big impact over there. There's also been I'd say internally in the organization, we've had to regroup and we've had to go back to the drawing board only to re-strategize again, to keep in mind these global situations, global scenarios, how they are impacting on us, and then go into the funding and the buckets and the priorities so that we keep above at all times. It's important for me as a CEO to have an environmental scan and to manage it in such a way that I'm always on the front foot. You don't wait for something to happen and then you act, but you've always got to be on the front foot. Understand these challenges, do your risk assessment as an organization. Risk assessment is very, very vital. And so in any organization, you've got to study the risks involved. How can you mitigate those risks? What are the actions you can take to improve those and to, mitigate those risks and challenges? Have a plan to be able to work. And this plan has to be something that is revisited all the time. None of these plans, can I say, in my 20 or 30 years of experience is, it's very good to have plans, but they've got to be plans that are really of course, they align with your vision and your value system, but plans also should be such where you are able to go and tweak it when necessary, because things may come up suddenly. There are global scenarios and global situations where you may have to have a flexible plan, and you've got to have a plan B if you cannot always have a plan A. So these are the challenges, Olaide, that I'd like to share.
Thank you so much, Melissa. You have really hit the nail on the head by telling us that organizations really need to be ahead of the game and be clear about where they stay in the marketplace, especially when it has to do with internal environment, the changing internal and external environments. And in doing that, doing what we refer to as environmental scan is very, very crucial. I will now go to Shani. One thing we know is that workforce issues, they are always at the forefront of impact during pandemics. And we are all in the know with, I would refer to it as ongoing pandemics, because like Melissa said, by the time we thought COVID was gone, then all manner of strains came on, and we are still dealing with it. Now, please, can you tell us workforce issues that you have had to deal with during pandemics in Blacktown organization? As not unit manager, I believe you will have a lot that you have dealt with. So what are those issues? And please also tell us how you were able to manage those workforce issues. Thank you, Shani.
Thanks, Dr. Olaide. Yes, so the pandemic has shown us that we always has to be prepared for these kind of disastrous situations. It was difficult, definitely. We're going through Delta, Omicron, and now the subvariant of Omicron. Because we only got limited staff, and we had to manage surge up in red activities, which we call COVID activities, in a matter of weeks, or I think the latest Omicron, it's days. So how we manage the workforce issues was one, because then we had staff contracting COVID, so we had staff going down on COVID leave or the sick leave, so that created shortages, and then we had issues with getting contingent staff from agency and casuals, because like, you know, either their children has COVID, or like the whole you know, society had issues. So there was limited amount of contingent labor that was available at the time. So then we had to look for ways how we're going to run these wards. So what we did was look at the green activities, which is normal hospital activities, and then we had to look at our red activities, COVID activities, and then have a look, okay, which wards can we, in terms of normal, you know, general wards that we could close, so we can actually get those staff to run our COVID wards. You know, so we had a couple of other sub-acute wards that got closed, so we could get those staff to run COVID activities, and then came the ministry advised to suspend the non-urgent elective surgeries. So we had some surgical staff to run our COVID activities as well, in terms of screening and COVID wards and, you know, those kind of activities. And then we had contracts with private hospitals, mainly for subacute. We had Girondale, Minchinbury, and then Holroyd and Lady Davidson, where the district CE has had contracts to send our patients as public patients, but in private hospitals. So that created some hospital capacity where we can have wards to accommodate COVID patients, because the private sector had limited you know, expertise and resources to manage COVID patients. And then we looked at transferring some of our cardiac and specialty kind of patients into Norwest and Macquarie under similar contract basis. So again, we create some capacity for COVID activities in public hospitals. And then we had a look at, like, you know, the contingent labor, like, you know, the staff to offer premium labor, you know, where possible, and any part-time staff to take on extra shifts, you know, building that relationships with them, knowing the nursing unit managers, because I took the lead as the operations lead. So I managed the staffing and operational roles in the COVID management situation. And we established our emergency control center as well, which ran with Dawn, myself, and a few other allied health professionals, and some from patient flow unit. So we had a coordinated approach to manage the influx of COVID patients coming in. And we also established like red patient flow and then green patient flow. So there was two you know, streams managing the two different type of patients that were presenting. So we like, you know, we didn't had to, like, one person literally had to not get overwhelmed with the volume that was coming into our door. I think that's how we overcome our workforce issues. And also we did run upskilling program for some theatre staff, some ward staff who was able to, like, you know, take on extra shifts in ICU environment. So we ran earlier in Delta wave that you know, educational programs to upskill staff. So we had some theatre staff willingly going to ICU in the Omicron wave, so which really reduces the strain on the other ICU staff that were available. So yeah, combined effort from everyone.
There was need for combined efforts from everyone. Now, Jan, if there is any addition to what Shani has said in terms of what the situation on ground was, in terms of workforce management during the pandemic, and how are you able to manage that workforce issues?
Thank you, Dr. Alani. Thank you. So very, very similar to Shani. We're also under a public health order because we're funded by the Western Sydney Local Health District. So from the beginning of the pandemic and to today, we come under a public health order, the same as hospitals come under, and we've followed that to the book so that we can create a safe environment for our staff and our clients coming to our centre. I spoke before about us having a policy in place where we don't turn anybody away. And when women come to us in crisis, they are not turned away. They are seen by us and assisted in our workplace. However, we have been able to provide telehealth counselling from our counselling team working from home. And we've had to deal with the North West Sydney Women's Domestic Violence Court Advocacy Service. They're coming under, even though they don't come under the public health order, they come under the policies and procedures of our organisation, and therefore they're required under the order and from our management committee to follow the safety precautions and policies and procedures that we've put in place to manage COVID-19, including both pandemics. What we've found is coming out of this Omicron section of the pandemic, it's been quite difficult. A lot of our staff are catching COVID and their families, and therefore we have to make sure we're under the health order, but at the same time making sure they can't come back to work unless they are negative, unless their PCR tests are coming back negative. However, what we're finding at the moment, the complication we're currently having, is that a lot of people's rapid antigen tests are coming back negative, but their PCR tests, which we require for them to return to the workplace, are coming positive. So most of our staff, except for our reception staff, can work from home. So under the public health order currently, if you have contracted COVID-19, you are required to isolate for 7 days. When you finish and not work from our perspective for our organisation. When you come out of that quarantine period, you're required to get a doctor's certificate to return to the workplace and have at least a negative rapid antigen test or a negative PCR test. However, we understand that there is a lot of shedding with the virus going on at the moment, which creates a problem with the PCR testing coming back negative. So we're seeing negative rapid antigen tests, and we all know that they can be difficult or unreliable to some extent. But we're following the public health order, and if a doctor approves one of our employees to return to the workplace and they're required to work from the workplace, we've now put a structure in place to ensure their safety and the safety of all the staff. So similar to what Shani would be doing in the hospital, they're required to wear a mask, a shield, a gown, and have limited contact with other staff in the centre. And they aren't our naturopath. Our naturopath would be able to do her consultations through telehealth. A massage therapist wouldn't be able to return until she was negative, because she's hands-on with the clients. And our family planning doctor and nurse clinic, they're under Family Planning New South Wales. They have a slightly different way of managing their clients than we do, but the questions that we provide to our community, to people coming into our centre from our clients, are the same no matter which service they're attending at the centre. At the beginning of COVID-19 in early 2020, we had a woman present at our centre and another group run by another organisation in our centre who was positive with COVID-19. We had to, therefore, the health orders were a lot stricter back then. We had to close our centre for 2 weeks, sterilise our centre, put our staff off, and they had to stay off until such time as that was what the public health order was saying then. Now it's not saying the same thing. So what I'm doing as a non-for-profit charity for our organisation is we've got a regular updated policy, the COVID-19 policy, that it gets updated and changed and inclusive of the different requirements from the Department of Health in terms of how our organisation operates. Unfortunately, we had some staff who refused to be vaccinated. All staff working at our centre of the North West Sydney Women's Domestic Violence Court, our advocacy service, must be vaccinated and now have their booster to continue their employment with us. Those that refused to be vaccinated, unfortunately, they were given an opportunity and a lengthy period of time to take their leave requirements until they could make that decision. And we did have a couple of people who refused to be vaccinated, and therefore their employment had to be terminated, which is extremely difficult in terms of your workforce, especially when they're good and great at what their jobs are, employees. So it's been a very difficult period of time for us. We've had to employ new staff to cover other staff. We've had to bring in casual staff to cover shifts and to work with us to ensure ongoing service delivery. And I know that the North West Sydney Women's Domestic Violence Court Advocacy Service is experiencing such problems as we are, and their work is very, very busy, as I indicated earlier in our meeting. And they really struggle with the amount of referrals they're getting. And I think at one stage, it was either last week or the week before, we had 6 staff out of 17 there off with COVID. So it isn't an easy time for any community organisation, and trying to meet the needs of community and ensure safety for all is our number one priority. We have a risk management plan in place, and we're regularly getting advice from our industrial advisors. So we have 2 groups of industrial advisors that we work with to make sure we're legally on track with everything we're doing and following the proper procedures. So it's a difficult time. It continues to be a difficult time. And with the loosening of restrictions with this new government leader, has been extremely difficult, because it's made the community much more vulnerable in terms of catching that COVID-19. And it's a great concern to me when you see in the news today the shutdowns in China of cities that are completely overwhelmed again with this 3rd strain of COVID, which is the next strain that's come along to Omicron. And we're just getting more and more of our stuff, their families catching it and having to isolate because of that. So I think everybody that I know is a bit tired of it, and we wish it would all just go away and disappear so we could get on with our normal lives again. It's a great strain on our organisation, and look, the funding bodies don't take that into consideration. So we're being funded by health means, and we're being a women's health centre, part of 21 women's health centres across the state. We have very poor funding for our service provision. So if I have a worker who's permanent part-time and she goes off sick, she has to be paid, of course, her entitlements to sick leave, etc. But we need to replace her so that we can run our business, and that's an extra on cost to the organisation. So it's a difficult time. It continues to be a difficult time, and keeping everybody's spirits up, keeping everybody empowered, keeping the clients empowered, but more than that, keeping your staff empowered so that they feel always admired, loved, respected, and that we have a great concern for their health, their well-being, and those of their families. That's the major thing, and keeping them understanding. Then we have a couple of staff now that look as though they might have long COVID, which means we all know what that means, that the side effects of COVID are detrimental to their health and well-being, and maybe for a very long period of time. And they're struggling with the concepts that they're really, even though they're no longer testing positive with their COVID, they're actually having very bad side effects ongoing, and they are exhausted, and those side effects are exhaustion and not being able to get out of bed or not feeling as though you can get up and do your job. So it continues, and as community leaders, we have to be strong. We have to work collaboratively with each other and community and our funding bodies to make sure that we keep providing our services to our community.
Thank you so much, Jan. Organizations, from what we are hearing from the 3 of you, is that they are complex places to be, whether community organization or healthcare organizations, and there is the need to constantly build the capacity of the staff. And some of the staff, many may be compliant, we have many times still be non-compliant. So, but they continue to be central. Now, I'll go to another interesting area which Melissa has spoken extensively on, but I will ask her to add if she has any addition. Otherwise, we'll just move on. And that is the issue of power and politics. These are key issues for organizations' capacity building. When Melissa was talking, she spoke about the need to know of the government in power in terms of, where they tend towards regarding many things that inform what organizations do when she was talking about environmental scan. Now, do you have anything to add to what you have said, Melissa, in terms of, can you please share a particular power and political issue that you have had to deal with and how you have successfully or otherwise managed this in building your organization's capacity? Please share some thoughts with us in that area. Thank you.
Thank you, Dr. Olaide. This is a topic that you can actually run a whole conference, a 3-day conference, and discuss it. It's very hard to synthesize, but can I just say that yes, in terms of, I've already touched base on it and that it's important. And I'll give you one very quick example that I can cite. That ministers hold a lot of power, government hold a lot of power. And so a very good positive in a kind of example that I want to say to you is, if you recall Minister Alan Tudge's announcement, maybe about 2 years ago, that really will have an impact or had an impact on all settlement in the country, where in a positive way, they removed the cap of 510 hours, allowing students to strive for vocational English rather than only functional English, and removing time limits for enrollment and completion, because that used to be a very challenging situation for many migrants that were actually learning English, because you and I know that it's very hard to have learned English, functional English, in 510 hours. So removing this cap of 510 hours made by Minister Alan Tudge at the time, I think was a very positive example that I can give you, where the government do have powers that influence and impact us in a very big way. And these changes really make a big difference to our migrant and refugee population who are working hard to improve their language. It ensures more people can achieve a higher level now of English proficiency, and it results in countless benefits, I can say, to their lives of the individuals as well as to their families. And I know that greater English language proficiency has flow-on effects into employment, to income levels, to their social participation, and outcomes for the children of these migrants and refugees over their life course. So that's just one example that I want to give you. I know we're running out of time. I have many others, but I'll keep it pretty small here to show you the impact of the announcement or a political decision that has an impact on our work, because this is the work that we're doing every day. Having English and communicating is one of our settlement standards as well, one of the 10, and I'd encourage people to look up the SCOA website, which is the Settlement Council of Australia, SCOA, as it is an umbrella organization of all the settlement agencies in the whole country. And I'm very privileged and fortunate to be the chair in my 3rd year now. And I'd encourage you to look at Settlement Council of Australia, look up the website, and to look at all these indicators there. And also it will throw light on many of these challenges that we've spoken about. Thank you, Olaide.
Thank you so much, Melissa. Much appreciated. Now, Jan, I'm sure you have had to deal with one or two or even more of power and politics issues in the many years of being in the Blacktown, in the women's and girls' ed sector and similar organization like that. Would you like to tell us, if there is anyone that quickly comes to your mind, but pretty much tell us the lesson that you learned in dealing with the issues, the issue of power and politics?
Well, to a large extent, we're still dealing with issues of power and politics, in particular around the way women's health centres across New South Wales are funded. So we're very, very poorly funded. We haven't had an increase in funding since 1986. For some reason, both state and federal governments doesn't acknowledge the remarkable amount of work we do across domestic violence and health issues, all sorts of issues for women and children and girls, and therefore they don't increase our funding. Now, the last state election that we had, Labor was very much the Labor government. So the two main parties, of course, in Australia are the Labor and Liberal government, and then we've got the Greens party that is an adjunct to them. But there's some other ones, the independents, but they're not really in charge of what's going on. So the Labor Party promised us, and that was their ministers at the time, that if they got into power, we would see a significant increase of funding across women's health centres in New South Wales. And of course, they didn't win the election. The Liberal Party won the election, and therefore we did not receive any increases in funding. How they expect us to run such important businesses on the smell of an oily rag, as you know, anecdotally, is beyond me. And we have to work tirelessly as managers and executive officers to apply for every strand of funding that's made available in the community welfare sector. And therefore, we're competing against our colleagues and our partner friends in the community. And that creates a lot of distress and tension, I think, between organisations who really believe, like we do, that we are a priority for funding, And yet other organisations in this community welfare sector would agree that they also deserve strains of funding. It creates a terrible dilemma and can cause a lot of distress between organisations in terms of their respect or understanding of what the other one's doing. So the fact that they turn funding for us and extra funding into a competitive process is completely detrimental to everything I've spoken about to you today and to the wonderful organisations that are here presenting with me. It's a detriment to us because we are fighting for money. An example of that is an organisation in New South Wales called Women's New South Wales had some funding for domestic violence. It was quite a big amount. It was $150,000 for a 12-month period. And I applied for it for us because we do a lot of domestic violence counselling and case management, but we're not funded for domestic violence counselling and case management. So by our health budget, not by our Legal Aid New South Wales budget for the North West Sydney Domestic Violence Court Advocacy Service. Both non-for-profit money coming to us, but one is fairly well funded, which is the North West Sydney Domestic Violence Court Advocacy Service. The other one is very poorly funded. So I'm working tirelessly to apply for grants all the time to meet the need of the clients that we have in our community to provide them with the counselling and case management support that they need. So I was unsuccessful in that occasion, and that I think was last year. So I contacted Women New South Wales and I asked them I said, why didn't I get it? If I don't get an answer, I'm going to the Minister to make a complaint because I'm very unhappy. They came back to me, and the person that came back to me started by telling me all the mistakes that I'd made in applying for the grant and how I should have answered such and such a question better or whatever. And he's talking to somebody who's been applying for grants for non-profit charities for over 25 years, you know. So that was okay. I popped it on the chin. I sat there and listened respectfully and didn't have much to say. I just took it all on board. And then at the end of it, I said, well, I understand that another organisation locally, or maybe one or two that are working because it's a competitive process, may have got that funding or did get that funding, and I found out later that they did. However, I said, it doesn't mean we don't have a need to meet, and it doesn't mean that we shouldn't have been funded. And he said, no, your scoring was quite good, Jan. He said, out of, just say, for instance, 1 to 5, he said, you were up there at number 4. And I said, well, thank you for telling me that. And I said, but I still am a bit concerned. I don't understand. And he said, Jan, we got swamped. We had 500 applications, and we only had funding for 200. So this is the information that we're not told. So they don't care if the organisation's providing funding, that we are spending hours and hours and hours of our time and in our own time applying for very important funding for our organisations, only to find at the end of that process that you weren't successful. And I usually just walk away and go, well, I'll try again. There must be some more money there I can try and apply for. And I usually don't ask the question, why didn't I get funded? And having to threaten to go to the Minister to somebody trying to fund a project, they're not very happy about that. But it didn't matter. It created an opportunity for me to get the feedback I needed. And when I realised what the actual real situation was, is they didn't have the money. They've advertised this money to go out to all the organisations, and you can see from the amount of people that responded to the funding, but the government didn't have the funding to fund us to do the job that was required. And this is an ongoing problem that we're dealing with in the non-for-profit sector, trying to get more done for our community. And the whole focus of what we're doing is all this money goes back to our clients, goes back to our communities. It's not held in reserve, or it's not allowed to be held in reserve, and it means we can work more effectively and provide better outcomes for our clients and our community. We can't do that. And so therefore, what happens, from my perspective, and I believe that the funding becomes a political vehicle for a political party to empower their own self and say, well, we're going to give women who need health outcomes, better health outcomes in New South Wales, or more domestic violence counselling support or whatever. We're going to give them $1.5 million across all the services. And guess what? More than half of those services who apply don't get the funding because they haven't put enough funding forward. So that's my frustration with that question. I wanted to share that because I think I saw Melissa and Shani nodding. I think that we're all aware of how when you get to be an old lady like I am, look, you do get, and having done this for so many years, you do get quite frustrated at the end of the time. So what do we do? I know what Melissa and Shani are doing. We're talking to politicians as often as we can and saying, this is what our community needs. This is what our new people coming to our community need, and trying to get the politicians on side to work with us. And we're lucky I've got some politicians on side, but that doesn't mean that the funding is going to come to me.
Thank you very much.
Us, not me, us, to our community. I applied. That's why I said me, but it doesn't come personally to me, but our community, which is our number one priority. Yeah.
Thank you, Jan. So very important lesson is that power and politics are crucial for any organization to continue to open their doors and continue business. Shani, in the acute health care area that you work in and you've been working for years, please can you tell us about a particular change that you led, and how did you mobilize and engage stakeholders, implementing that change? Maybe the powers that be, the people that you are dealing with, those that are below you, all the people that matter in implementing that change. Please kindly share with us.
Sure, thank you, Olaide, again. So when I think about organization change, I mean, it's always been a team effort. I don't think we could, do any change with only ourselves. So one of them that I can recall is when I was the nursing union manager. That we implemented telemetry on our ward. So that was a whole new change for my staff. I had 6 specialties already that we are housing in my ward, general medical ward at the time. And on top of that, getting another specialty, I mean, a major specialty was really difficult on them. But then there was a need for it. Like we had a lot of cardiac presentations that our just standalone cardiac ward and the coronary care wasn't able to cater. So we needed to have at least some capacity for telemetry monitoring in our ward. So what we did was had discussions with all the stakeholders, including myself, obviously, the patient flow managers, the dawn, the nurse managers, the general manager, the cardiac ward NUM and the cardiac CNC, the educators in my ward and the other wards, to come to a plan how we're going to roll this out. And the communication is being the key for it. How I presented it to my staff, because, having already we had 6 specialties, which is renal, infectious disease, drug and alcohol, toxicology, and rheumatology and immunology. So 4 out of 6 were quite a major admitting specialties. So then we had negotiations, so in terms of accommodating cardiac patients, we said, we need to give up one of our major other specialties because we're not going to be able to, skill all the staff with the necessary skills and provide that education if we keep cater for everything. So that was successful. So we were successfully able to move our renal specialty to another ward that had less specialties, and we accepted the cardiac telemetry patients. So how I implemented that was with the team. So we had board meetings to discuss, had standing agendas, given staff to think about it, leading up to it. It's like we had about 6 to 7 months leading up time. So had team discussions, myself, and then obviously if staff had issues that they didn't want to talk to me about. So there was other stakeholders that came and talked to them from patient flow unit and the other, nurse unit manager and the educators. And then we had individual discussions with the people who really had concerns, some of them are being, nearing retirement, and then they didn't really want to learn a new skill. But then having that negotiations with them, giving that leadership to the other junior staff and skilling them and encouraging them also, telling them that they can actually do that, empowering them. So really helped and put them through education sessions, regular basis. And then we did some rotations into the cardiac ward. So they get to learn and breathe how the cardiac monitoring works, and then get to learn from the PAs that was on the ward. And then finally on the implementation day, it went well because the staff were pretty much I think we had about 14 FTEs out of 20 that were fully trained and had all passed all the competencies when we implemented it. So that was a success. And then we had evaluation sessions, and also from the beginning we had time frames, because otherwise with any change that's very important, because otherwise you just lose your motivation and the because time flies, so you just lose the track of things. And then collaboration with everyone really made it a success, and including actually the technical people that helped us putting monitors in and how teaching us how it works and all that. So biomedical unit was really helpful in the change. Yeah, so it was a success, and now we are into about 3 years now. No issues. They've more build up their skills, and now some people are training to do the advanced life support as well. Because we weren't providing that before from our board anyway. It was mainly cardiology board and the CCU staff provided that care, but we are training our staff to take on those roles as well now.
Thank you so much. Shani, how about you, Melissa, in terms of any change that you have led? Just maybe one, and pretty much how did you mobilize and engage stakeholders? It's very important to us in implementing that change.
Thank you, Dr. Olaide. As an organization, these changes are happening on a day-to-day basis, literally every day, and depends on which program that we're dealing with, whether it is our settlement or whether it is the business or the youth or the early intervention. Pretty similar to what Shani has spoken about as well. Very similar, but in our space as a not-for-profit. So I wouldn't say that we're too different. The changes now I can say to you is firstly at a macro level from a national perspective.
Just quickly, what's the highlight of your leadership style in the strategic development of your organization's workforce capacity? If you are woken up early in the morning and just what is the highlight of your leadership style in terms of the strategic development of your organization's workforce capacity? What would that be, Jan? Thank you.
I have a really positive view on looking after our organisation, and I feel most grateful to be supported in that objective by a wonderful management committee. It's very, this is something that an executive officer doesn't do alone and can't do alone without the support of a team of a management committee in the community sector to support her. And I'm very grateful to have an excellent management committee that I can go to and talk to. That's a highlight for me of my career since being at Blacktown Women's and Girls Health Centre is to have had such a wonderful management committee that I can go to and talk to about the needs of the organisation and the clients and our staff. I'm available for our staff I'm available for our organisation 24/7. I mean, no, it's in the training on executive management training, it's encouraged that you don't do that. But I do that because I think it's important for me to be on point at all times in terms of the work health and safety of all the staff coming in the centre, and to be able to support them in any and all needs. And surprisingly, it's not as arduous. Obviously, I don't have as big an organisation as Melissa does with 150 staff, which may be more difficult because I have a much smaller cohort of staff. Sometimes I'm waking at 6 o'clock in the morning with a text message or letting me know if somebody's unwell or something's happening. But it doesn't bother me. It empowers me to know that all the staff are working with me. I feel empowered to know that I've got a wonderful team, that everybody's across what they need to know, that they need to know that I'm there for them. Because if I'm there for them, the culture of the organisation is enhanced by knowing you're supported as an employee, knowing that your manager, executive officer is always there for you, knowing that I'm approachable and that they can actually reach out to me on any and every matter, and I'll do my very, very best to ensure positive outcome for them. So I've learnt from hierarchical level of management. Like when I started in the New South Wales Women's Refuge Movement, which we provide what's called shelters now, but we provided them for women across New South Wales, which was an accommodation and support service. Back in those days, they were collectives. So that meant that as a team, yes, we did have a leader of the team, which we call the manager, but we all came to decision making as only women can, or have done since millennium, in a combination of coming to an agreement about something on a vote. And it's very different from patriarchal society that we currently live in, and more aligned with matrilineal society that I think as women we should be operating more in that frame. However, even with great respect to you all, and particularly Dr. Lydia Ogunsiji, we can't seem to find a way through the university education process to find a way of living that's not hierarchical, that's not matrilineal, and not by combined women making decisions to come to a decision as a group rather than an individual. And I see hierarchical institutional behaviour the same as empowering to patriarchal society and predominantly men. And yes, I'm a staunch feminist, so please bear with me. Whereas I believe women should be more in power and more making the decisions for our societies than men, based on what we believe is equality for all, empowerment for all, and what women know our families, our societies, and our children, and future women and current women need to uphold, so that more powerful women can come forward and we can try and get on top of all the abuse of women that's happening across society generally. So I feel empowered when I wake up in the morning to know that that's my voice, and that I have a voice as an executive officer. I'm invited to speak at a lot of functions. I'm invited, as I was clearly so appreciative of being invited today to this forum for this lecture by Dr. Lydia Ogunsiji. I'm really feeling very empowered by her picking me to be here with these other amazing women, Melissa and Shani. And I feel empowered by this whole process today. Waking up knowing that I've got an opportunity to make people's lives, women's lives and children's lives better. My staff. One of the key things I learned that I wanted to come back to. And I think this has only just been quite a change within our approach from the patriarchal and the paradigm of hierarchy. What we're now coming to generally, which must have come from the great thinkers in universities and so forth, and with reflection on community, is that we're now looking at treating our staff like we treat our clients, which is a very different paradigm to the way we've treated our staff before. So if you treat your staff like they're a client, you're showing more love, more consideration, more compassion, more kindness, more care, and more. And I think that's a wonderful thing to do, rather than saying to a staff member, you don't have a voice. I'm not going to hear you. You can't just, you can't give me an opinion that you want me to take on. Not being open to all those ideas and the wonderful things that are brought back to us through from our staff, through a range of cultural and other voices that we can take on and hear and learn from. And that empowers me every day to know that I'm working hard to overcome my patriarchal training in the past of how you manage a business, and take more on board my approach that I've adopted, that I've learned recently in the last few years. And it's great for me as somebody who will be heading into retirement in a couple of years' time. It's wonderful for me to be able to be that now, and not be what I thought my employer wanted me to do or be for many years. I now have an opportunity to be in that frame of empowerment of my staff and encouraging them the same belief system to work with each other and the clients.
Thank you very much. I'll quickly go to Shani before getting back to Melissa. I'll quickly go to Shani. As the nurse unit manager for a number of years now, you have all levels of nurses that you manage: registered nurses, enrolled nurses, enrolled nurses, assistants in nursing, and even other allied health in your ward, and even beyond your ward in the hospital. What is the highlight? How can you describe what is the highlight of your leadership style in the strategic development of Blacktown Hospital's workforce capacity? Please let us know something in that area, Shani. Thank you.
Thanks, Olivia. Again, as Giant spoke, I think in health we still see a bit of a hierarchical management system. However, reason is I think we are more moving towards more transformational kind of leadership styles, which I have experienced anyway. And as myself as a manager, I mainly focuses on communications and goal setting and also encouraging staff. So when I took over my ward, I've actually invested a lot of time in developing the culture, because I think that drives everything else. If we have a good working culture, then staff is willing to come to work. And setting that positive environment was a key thing for me, which I think I've achieved to some point. It's an ongoing work. Now I'm focusing on all my areas, because at the moment I'm acting as the HKNS manager, so I'm focusing on all my geriatric wards at the moment, because it's a difficult area to attack, track staff, given that workload is heavy, and then there's other challenges with behavioral components and day-to-day businesses are a bit difficult than a normal ward. So we are doing campaigning to attract more staff, in terms of providing them that we are working on developing a positive work culture in the wards. And also I think the best thing highlight would have been for me is the relationships that I've created, most of the time through that relationship with the nuns and even the ward staff themselves, and it works for your own success as well, or in terms of how did you say what I meant to say is, when we had issues with staffing and things like that, when I had that close relationships with the ward nurses as after I was manager and also doing other roles, they helped me out in terms of offering willing to take additional shifts as an overtime shift or a extra shift, so really helped assisted us, all of us, to run the organization in a very difficult time. So relationship building was a big highlight for me, whether it's the higher level management, executive level, or whether it's the ward staff and the nuns that I work with. Both ways it's been really can come together to achieve good outcomes for our patients. With the COVID, it's been challenging across, and it's still challenging. And I think we all survived because of those strong relationships that we had with each other.
Thank you so much, Shani. You see yourself as a transformational leader. Thank you for sharing that. All right. Okay, now we are beginning to round off, and I will get back to Melissa now. She was trying to to tell us before about how she was able to mobilize and engage stakeholders in implementing a particular change. Melissa, can you please speak to that? And as well, tell us the highlight of your leadership style in the strategic development of the organization. Yes.
Thank you, Olaide. I know we're running out of time, so I'll just be very brief and quick, and I'll merge both my So one of the things that firstly, I just want to point out the scale of our organization. We actually provide services to over, say, 27,000 clients per year. Calculate that into 25 years. We've actually just completed our 25th anniversary of the CMRC. 675,000 people have walked through our doors. Now, what I want to point out is one of the things that I've observed in the last few years is that, look, we get funded by the government, and not all of our funding is meant to be for all tiers and all people who come in from all walks of life. So we get funded mainly from the Department of Home Affairs. That is meant for newly arrived, whether if they're refugees coming legitimately. But what about the assistance for asylum seekers? Now, asylum seekers are people who have had either arrived lawfully in Australia on a temporary substantive visa, or people who have arrived in Australia by sea or without a valid visa. Now, I find in the work that we've done over a long period of time now, there are hundreds and thousands of people literally who are on these visas. And sometimes their status is not resolved. Sometimes they are in limbo. Their visa is in limbo. And, Australia provides protection for, these people, asylum seekers, during their determination process, during that time. But then again, that protection is to those who engage in our protection in line with our international obligations, especially under the Refugee Convention and other human rights treaties, etc., etc. So, long story short is, what I want to say is that for us as an organization, we've gone over and above. And like John said, we don't turn anyone away from our organization. It doesn't matter whichever visa class they come under, we still will provide service to even asylum seekers. We've done that in the last few years. And we know whether you're a permanent or a long-term temporary entrant, really not all migrants and new arrivals really need special support or services, but the eligibility is what I think organizations like ours have a kind of a choice to make. And so eligibility becomes the most important and critical one. And so what we did is how we have worked around the system. We have worked around we've got multiple programs. So it doesn't matter if our funding is from the major funding is from a particular government, state or government body, federal or state. We have worked around it so that we as an organization don't turn anybody. We mobilize our resources, we mobilize our services in such a way where we are able to provide those resources. I see myself now going to the second question. I'll just be very quick about it. My leadership style is let's grow together. Okay, so I lead. I'm not going to say it's particular transformational, but I also think it has an element of transformation leadership in it, because transformation leadership for me begins with me. Leadership begins with me. And in the organization at the CMRC for the last 21 years that I've been the CEO at the CMRC, I have dealt and have led the organization in such a way that I have taken the organization together with myself. The teams, the management, the staff, as in the management team, together with myself, that we all grow on this journey together, rather than only the one person or the leader. For me, a leader means that we grow together, and it's important that you have someone to lead, but it's also that the leadership is shared. And for that reason, I want to say to you and to the people that are listening to the LID that in my organization, which is very unique, I have got at the anniversary celebrations, I read out the numbers of years. The majority of our management team has stayed there for 25 years, for 20 years, for 17, 18, and above years. Majority of the staff have stayed there between definitely over 10 years, but between 10 and 15 years. So when you look at an organization like ours, that is a vibrant organization, staff turnaround.
Grateful for your generosity in sharing your thoughts in responding to all these questions. So we only let me just give you opportunity for just one parting word each, and then that will be the end of it. Shani, do you have a parting word before we call it today? Thank you.
For students, I just have to say, just trying your best and build relationships, and we can make this a better place.
Thank you. Jan.
Oh, thank you for the wonderful opportunity, Dr. Lydia Kasiji, and to meet with these wonderful women today, Melissa and Shani, and to know that the students will be watching this. So it's a lovely, wishing them all our very best wishes.
Thank you so much, Melissa.
One of the things that I wrote in my book is I just published a book called The Girl from Mumbai, and I said we're blessed to be in Australia, the land of milk and honey. So to you students, go out there, put your best self there.
Excuse me? Hey, what's your problem? Hey, what's the problem, Indian? Indian, who इसीलिए बोल रहा हूँ? वाला प्रधानमंत्री वहाँ नहीं। ओ, रवि नाथ। बोले कोली देखा था, तुम्हारे देखा था, तुम्हारे में देखा था क्यों? ओ, बोले मुंबई में उनसे तो क्यों बने? क्यों बने? सच्चे बने वो। मेरे साथ जेब नहीं उनसे